Hello, my name is Bimbai. I'm an occupational therapist, and my capstone project proposal is on promoting health management among older adults with chronic conditions at the Forum at the Crossing Senior Living Facility, which is where I work. I will go through my PowerPoint. My outline is introduction, the significance of the problem, the purpose of the project, the role of occupational therapy in health management and the evidence, and the plan of the occupation focus project, the guiding model, the project measure, and the conclusion. So recent healthcare reforms are promoting prevention of diseases and conditions in order to improve population health and to improve quality of care. There are national initiatives to improve care for population with multiple chronic conditions, and historically, the US has had a reactive response to acute medical issues and have been unable to manage chronic care needs of population effectively. So health profession is within the scope of OT, and it is a concept that is well rooted in the profession's foundation. So traditional medical model is expensive and is ineffective according to the National Council of Aging, and only less than 1% of healthcare costs are spent on prevention to improve health. And there are national goals to improve health and promote well-being and prevent diseases, according to Healthy People. And the American Occupational Therapy Association Vision 2025 also has goals to promote health and well-being. And occupational therapy, through its holistic approach, can contribute to the national health reform. The significance of the problem. According to the National Council of Aging, about 80% of adults have one chronic condition. About 68% of Medicare beneficiaries have two or more chronic conditions. 95% of healthcare costs are attributed to chronic diseases, and chronic diseases impacts individual engagement in life activities. And according to Absman and Mosley and Leland and others, healthcare reforms are promoting prevention of diseases and improving population health and quality of life. And efforts have shifted from reactionary to a proactive, preventative approach instead of addressing the needs of the individual or the acute conditions of the individuals. Emphasis is being put more on prevention. And the purpose of my project is to promote health management for community dwelling older adults with chronic conditions at the Forum at the Crossing Senior Living Facility. So the role of occupational therapy in health management. Occupational therapy addresses instrumental areas of health management with the following methods: problem solving, coping skills, and setting individualized goals, or enlisting family support, or practicing skills that promote health. Also, early identification of diseases or promoting management of chronic conditions and delaying institutionalization are all methods of promoting health. So there was a national study by Ori. It showed strong evidence on the effectiveness of chronic disease self-management program to promote occupational performance. And this is a group activity-based intervention. It, it is done in 15 hours over a 6-week period, and it promotes building skills, sharing experiences, and providing mutual support. And some of the topics that are addressed during these group meetings could be pain management, nutrition, exercise, and medication use. And it's led by 2 trained facilitators, one who has a chronic condition. There is evidence on the effectiveness of health management by OTs. And the first one I'm going to talk about is a systematic review by Berger and others. It investigated the effectiveness of health management in the scope of OT to promote quality of life in community dwelling older adults. The results showed strong evidence supports group, individual, and a combination of group and individual intervention to improve occupational performance. There was another systematic review that was done earlier by Absman and Mosley, and the results showed moderate to strong evidence that client-centered, occupation-based OT improved occupational performance and physical activity related to health management. And moderate evidence was found that self-management program result in decreased pain and disability, and also incorporating cognitive behavioral principles in physical activity. It promotes long-term adherence to exercise. And then the CDSM also was found to be effective in promoting health management by Berger and others. There is further evidence on the health management by OTs to promote health. So Gavi and others, they investigated the effectiveness of OT-led self-management support group called Optimal of clients with multiple chronic conditions. It was a feasibility randomized controlled trial, and it was a 6-week British community-based program. And Optimal, it incorporates peer support through group format. It addresses things like healthy eating, fatigue management, maintaining physical activity, managing medications, individualized goal setting, communicating effectively with health professionals. So, like I said, the results showed that there was a significant improvement in activity participation and perception of activity performance and self-efficacy, satisfaction, and independence in activities of daily living and quality of care among the clients that had the intervention compared to the control group that did not have the intervention. There's another study by Clark in 2011. They did a study using the program Well Elderly 2, which has changed its name to Lifestyle Design. And it was designed, the lifestyle design was designed with the application of occupational science. And it involves 2 hours per week of group-based intervention and 1 hour per week of one-on-one therapist-client interaction. And The results from that study showed that the intervention group had greater quality adjusted life years, which were achieved cost effectively, and favorable changes were found in social function, mental health, and life satisfaction. There's a program that was implemented by Fowler in 2019 by assessing her program on her follow-up assessment. The results showed that upstream showed participant had a significant change in general health and quality of life for the better. There was positive gains in quality of life. My plan for the project, the type of project that it will be a program development. First, a needs assessment will be done in health management. So a survey will be done on the personal and environmental factors that influence residents' participation in occupation of health management. And also a survey will be done with the activities directors on the activities that they do that address health management, such as medication management, peer health groups, nutrition and exercise, and also based on the literature review and research, proposed activities would be made. So group activities on health management topics, such as making time for valued activity, groups that are going to address nutrition, medication management, assistive technology, and interventions, and especially targeting healthy routines. So a proposal would be for weekly groups, and so all these activities are based on the needs assessment and on the literature review. And for the project measure, a survey will be done with residents prior to implementation of the program, and a post-survey will be done with residents after implementation of the program. The guiding model for the project is the Person Environment Occupational Performance, PEOP. And the PEOP is a conceptual model, and it considers the interaction of the person with the environment and the skills that they need to manage the occupation of health management. So in order to manage one's health, the individual has to identify the issue, they have to seek for care, and navigate the healthcare environment. So the person has factors that impact their ability to perform the occupation of health management. And these factors are cognitive, neurobehavioral, physiological, and health literacy. And then the environment plays a factor in how someone will manage their health. Some of these factors could be physical. For example, the print of the material or the sign can affect how someone can carry out their health management. Extrinsic factors, social support, societal stigmas, the attitudes and natural built environment, the culture, the norms, and the values. All this impacts how someone will be able to perform the occupation of health management. So occupational performance is based on a complex interaction of the person, the environment, to carry out the tasks, including activities of management of health. So the project measure. So Using the information from the literature search and needs assessment, a survey will be formulated to provide insight into the client's quality of life, their function, their preferences, and their goals. And the patient-reported outcomes will ensure gathering of information only a patient is able to provide. So a project measure is important. Data is useful for program evaluation. These program objectives are assessed to determine if the program's outcomes have been met and also if the client's outcomes have been met. And a survey will be done with residents prior to the implementation of the program, and a post-survey will be done after several weeks of program implementation. And also attendance to the program will also indicate the level of interest among the residents. In conclusion, this capstone project is in line with national goals and the American Occupational Therapy Association goals of promoting health and well-being. Research evidence was found on the effectiveness of group health management to improve occupational performance and quality of life. Occupational therapy addresses instrumental ADL of health management, and health promotion and management requires the implementation of prevention. Individuals, groups, and populations can benefit from occupation-based strategies. And thank you. And here are my references.